Hi, I'm Dr. Parijat Kumar, the Director of International Sports and Orthopedic Manual Therapy. I hope you enjoyed our today's virtual lab on thoracic spine and ribs assessment. It was a bit complex, so we understand we will keep on updating the evidence so that you guys can learn. So welcome to our today's virtual lab quiz answers. Let's get on to the answers for today's quiz. The first question was, where does the apex of thoracic spine lie? The apex of the thoracic spine lie, we have a spine over here, is actually from T7 and T8. So the correct answer was the fourth option. T7 and T8 is the apex of thoracic spine. The next question was, where does the transverse process of T6 lie with respect to the spinous process? So again, if you see, and if you remember the rule of 3 that Dr. TJ and me discussed, that when you palpate the thoracic spine, the level of the transverse process shift half an inch or 1 inch or one full vertebra, sorry, not the inch, but half a level, one full level, and then half a level, and then at the same level. So for T6 specifically, the transverse process lies half level below. So if you see over here, that is your T6 at this particular level, and this T6 lies half a level below. So the correct answer is option 2. Next question, what happens at the costotransverse joint with cervicothoracic flexion? When you have a cervicothoracic flexion like in the forward head posture, so what will happen to your costotransverse joint, which is the joint between your transverse processes of the vertebra and your ribs? The correct answer is there's a superior glide and an anterior roll. So that actually will help you in the future to localize your mobilizing or manipulation force, because if you don't know which way the costotransverse joint is translating, you cannot really work on the rib angles and those joints. So the correct answer is option 1, superior glide with anterior roll. Next question was, which of the following is a palpable structure? It's a very simple question, guys. So when you are palpating the thoracic and the ribs, the structure that can be palpated is actually your rib angle. The other options like rib groove, the demifacets, they are not really palpable. So the correct answer is the rib angle, second option. Next question was question 5. Which of the following segment will you manipulate to produce a neuromodulatory effects in a patient with the chronic regional pain syndrome with right lower extremity pain? Now, if you remember the sympathetic innervations of the thoracic spine and its related extremities, you should be knowing that the lower extremities are supplied by the lower thoracic level. So obviously the correct answer would be the second option, which is T7 to T12. If you're treating the lower extremity, you have to work on the lower thoracic. If you are working on the upper extremity, you have to work on the upper thoracic level to change the neuromodulatory effects towards those extremities. The correct answer is option 2, T7 to T12. Next question, it was a tricky question. Which muscles play a key role in resting or silent expiration? So when I'm taking a deep breath and when I'm breathing out, so breathing out or the expiration silent is actually a passive phenomena, a silent phenomena. So the correct answer is none of the above. You don't use any muscles in silent or resting expiration. None of the above, fourth option. Next question. Which of the following will cause a decrease in thoracic kyphosis? Generally, you will find that in many conditions you have increased kyphotic postures, like whether it's a postural thing, it is a Schurman's disease, or it is a scoliosis, or these are pathological fractures. In those conditions, you will find the increased thoracic kyphosis, but the question asks for a decreased thoracic kyphosis, which is the Bactrieu disease, which is the HLA-B27 positive. So option 4, Bactrieu's disease, is the correct answer, where you will find the decreased thoracic kyphosis. Next question, which of the following dysfunction will you suspect if the patient presents with a unilateral sharp pain, restriction in side bending, and pain with breathing or sneezing. So these are the symptoms and the signs that your patient tells you. You should be knowing that option 1, which is the costovertebral joint, can cause a sharp pain on the unilateral side and the symptoms along with that. So the correct answer is the costovertebral dysfunction, option 1. Next question. Which of the following segments will you treat if the patient is having the hyperactivity of the stellate ganglion with the symptoms of chronic regional pain syndrome in the hand? Now, I told you in the beginning that in a question above, where if you want to treat the extremities, you would be treating more like a upper thoracic or the lower cervical. But we are talking specifically about the stellate ganglion, which is actually located from C6 to T3 and on the first rib. So the answer was quite obvious. Second option, C6 to T3 and first rib is where your stellate ganglion is located, and you will work on that area or manipulate that to prevent the hyperactivity of stellate ganglion. All right. So next question. Question number 10. What is the capsular pattern of cervicothoracic junction? Quite simple. All right. So you need to know the capsular pattern of cervicothoracic junction. It's a very simple answer, guys. It's your option 1, side bending and rotation to the same side, followed by flexion or extension. So side bending and rotation to the same side, followed by the flexion and extension, is the capsular pattern of your cervicothoracic junction. So that was all for the questions of the thoracic spine. Coming on to the bonus question, you know we always have a bonus questions so that we can ask you about our previous labs, because these things work in a regional interdependence way. If you don't work on the thoracic spine or the pelvis, you are not correcting your patients in the proper biomechanical chain. So again, we have a bonus question on a pelvis. The question is, the patient is a 32-year-old female presenting with a postpartum pain in the left pelvic region. And the findings were, the sitting flexion test is positive on the left side, the standing flexion test is positive on the left side, and the sacral base is deep on the left side. So all the signs are positive on the left side, and this is actually a very simple torsion of sacrum, which is R on R. So right on right is the sacral torsion, where you have all these tests positive on the left side. So option 3, R on R sacral torsion, is the correct answer. Another question on the arthrokinematics of lumbar spine, the 12th bonus question was, what happens to the left zygoepiphyseal joints of L3, L4 with the lumbar rotation to the right L3, L4? So these arthrokinematics are confusing. If you don't know these, please go and study that, and then you will get to know about your mobilizing and manipulation force. So we are asking about the left L3, L4 facet joints with the rotation to the right L3, L4. The correct answer is that the facet joint moves up and forward on the left of L3 over L4. So the option 1 is that your left side is moving up and forward on L4. So L3 is moving up and forward on the L4 on the left side. All right. So that was the bonus question, guys. I hope you enjoyed today's thoracic spine and ribs assessment lab. It was a bit tricky, a bit confusing. Please revise it. You can retrieve all these recordings on our website, which is coming soon. So all these labs will be on the website. If you have any questions and concerns, please email us at isorehab@gmail.com, and we will continue to do these labs every weekend and the courses. And please stay tuned and watch our social links, media, and our website to get further updates and evidence-based knowledge. This is Dr. Parijat Kumar from International Sports and Orthopedic Manual Therapy. Take care. Keep learning.